Focus on Health, your weekly dose of health and wealth information on KUTV.
Welcome to yet another interesting episode of Focus on Health. My name is Bwari Michelle. So as this month is the Men's Health Awareness Month, we are celebrating it by creating awareness and taking you through a men's health series. Last week we talked about infertility in men, and today we're going to be talking about prostate cancer and also testicular cancer. Are they curable? Why do men shy from getting regular checkups? And most importantly, why do they cringe at the thought of going for the diagnosis method to detect these diseases? Dr. Solomon from Nairobi West Hospital will be taking us through this, but even before that, let us check out the health updates.
Men's Health Month is an annual observance aimed at raising awareness of preventable health problems and encouraging early detection and treatment of diseases among men and boys. Over 30 million men currently suffer from prostate and testicular problems that significantly impair their quality of life. Despite the prevalence of these prostate and testicular conditions, the good news is that prostate and testicular conditions are relatively easy to prevent, detect, and treat. To take action to promote optimal prostate and testicular health, men of all ages should eat a healthy and balanced diet, exercise regularly, get regular checkups, and perform self-checkups on a regular basis.
That was the very informative health update, and with me on set is Daktari, and our topic today is prostate cancer and testicular cancer as we still create awareness on the Men's Health Awareness Month. Thank you so much, Daktari, for joining us today. So Daktari, even before we head down to our topic today, kindly introduce yourself to our viewers.
Thank you very much for having me here. My name is Dr. Solomon Guimutua. I am a medical doctor. To be specific, I'm a cancer specialist, what we call an oncologist. And what I do for a living is I'm the resident oncologist here at Nairobi West Hospital. So I take care of all cancer patients who need cancer care in this hospital.
So Dr. our topic today is prostate cancer and testicular cancer. How would you define these terms?
Cancer basically is, in general, cancer is a disease of abnormal cell growth. Okay? And the reason why it's cancer is because it has deviated away from the normal cellular growth and taken the pathway of malignant growth, okay, cancerous growth. And cancers usually are a genetic disease, and by genetic I don't necessarily mean hereditary, but it just means that there is an abnormality in the gene which causes development of cancer. So when you look at testicular cancer, then this is abnormal growth that occurs in the testicular cells. And the same way when you look at prostate cancer, also you have abnormal cell growth which transforms into cancerous cells in the prostate gland. So that's how I would define these two diseases.
Okay. Dr. Is there any difference between prostate cancer and testicular cancer, or are they interrelated?
Okay, these are very different diseases, and the only thing they have in common is that they occur in men, or in the male species of human beings. They do have quite a number of differences, and one of them is the anatomical location. Okay, the prostate cancer originates from the prostate, which is a gland found in men only in the pelvis. Okay, and the testicular cancers occur in the testes, which are the gonadal organs in male. Another difference between these two cancers is the age. Okay, you'll find that prostate cancer is mainly a disease of the elderly. Okay, you find mostly the median age group of this disease is around 66 years old. You can find it in men who are in their 50s and rarely in their 40s, but mostly the older a male gets, the higher the risk of this disease. So prostate is more for the elderly. When you look at testicular cancer, it's the opposite. Testicular cancer is mainly in young men, And the age range between these testicular cancer is mainly from the age of 15 to 40. So majority of the patients are within their 20s, but you can have as young as 15 and as old as 40 years old. Another difference you can get between these two diseases is basically the race. You'll find prostate cancer slightly afflicts the blacks compared to the whites. And on the other side, the testicular cancer is the opposite. It mostly afflicts the whites, followed by Caucasians and Hispanics. And finally, the blacks are usually at the lower spectrum of the incidence of this disease.
Now that, Doctor, you've talked about age, is there any particular reason why maybe we have prostate cancer affecting old people and testicular cancer affecting the young people?
I guess it's just disease behavior. Different diseases in medicine usually occur at different times. Okay. And usually when we look at cancers, I say it is mainly a genetic disease, but usually have risk factors, now things that predispose an individual to these cancers. And you'll find that for prostate cancer, the major risk factor is age. So the older you get, the higher the likelihood of getting this disease. And that is how just this disease work. They only occur at a certain age group. For testicular cancer, you have other risk factors, but for them, it's not really advancing age. Okay, we have things like family history, previous testicular cancer, use of marijuana. So basically, the age distributions of these two diseases really is just a reflection of how these diseases behave. So they can't just appear in any other way. So it's just how the disease is.
Dr. Maybe now you could tell us about the signs and symptoms. How would you know that you've developed either prostate cancer or testicular cancer?
First of all, I think the greatest advice I can give our males in this part of the world is awareness. It's always good to be self-aware of your health. Okay, and for the young men, as long as someone is past puberty, older than 15 years old, it's always advisable to just examine themselves at least once every month. And how would you examine yourself? The best way is during a hot shower or a warm bath, because during a warm bath, then the scrotum becomes a bit loose and they are able to examine themselves. And in case they feel any abnormality, like any swelling that is abnormal, any lumps, any masses, any nodules, then they should seek medical care. For the prostate, for men, again, it's always good to be aware. Once someone is 50 years old and above, it's always good to go for annual medical checkups, and the doctors usually advise patients on age or risk-specific evaluations. When you come to prostate cancer specifically, for men who especially have family history of prostate cancer, maybe they had a father or a brother, first-degree relative who had prostate cancer, then it's always good to go for a specific test called PSA, prostate-specific antigen, and this is just a simple blood test that checks the levels of this antigen in the blood. Also, men who have had close relatives with breast cancer, pancreatic cancer, also need to be evaluated for this prostate surface antigen test, which is done once every year or once every 2 years. So basically, it all depends on the kind of risk that an individual has. Another thing about awareness is being aware of the symptoms of these diseases. For the testicular cancer, most common symptom is swelling of the testes. Mostly it's one testicle, but rarely you can have both testicles being affected, so you get masses of both, but mainly it's one testicle. And this is usually a painless mass. Okay? So if our young men notice this, then it's always good to present themselves to hospital. Sometimes they can, If the disease is a bit more advanced for the testicular cancer, they can have other symptoms like back pains, abdominal pains, weakness, night sweats, weight loss, poor diet. So these are what we call constitutional symptoms, which are very non-specific, but specifically symptoms for testicular cancer is just swelling of the testicle. For prostate cancer, again, if it's early, then usually it's completely asymptomatic, has no symptoms at all, and most of these early prostate cancers are discovered incidentally for people who go for regular routine checkups. But when they have a bit locally advanced disease, then they usually have obstructive symptoms. These are symptoms like poor flow of the urine, or obstructions of the urine. So basically those are things to look out for when we are specifically considering these two diseases.
So Dr. we are going to proceed from there right after the commercial break. We are going to take a slight commercial break. Make sure you continue hitting us up on our social media platforms at KUTV Focus on Health on Facebook and on YouTube, and Health Focus on Instagram, and we'll definitely get back to you. I will leave you with the Did You Know segment. Do not move a muscle.
Did you know men should begin regular screenings for prostate cancer at the age of 50? This is because cancer usually affects men in their 60s. It's important to begin screening ahead of then. The screening is a combination of a simple blood test and a digital rectal exam. The average age of diagnosis for testicular cancer is about 33 years old. Regular self-exams are important in proactively screening for testicular cancer. If detected early enough, testicular cancer can often be treated fairly easily. The treatment will involve removing the affected site. A mass does not always mean cancer. As with other cancers, just because there's a lump or a mass that's found, it doesn't mean that it will be cancerous.